Insanity is doing the same thing the same way and expecting a different result. Now, if anybody here thinks that they can eat the same way that they ate before and expect anything different than a result after having a surgeon like me, operate on you, I got a little bridge to sell you. Anybody who thinks they can just, I'll just eat less, or I'll just eat a little differently, well, that's not how it works. We're going to set a goal for you right here and right now. If you think you're at goal, great. If you want to stay there, we'll work with that. But we're going to set a goal for you. Okay? This is a BMI table. You all remember seeing the BMI table because that's kind of what got you into surgery? Okay? Your goal, here's height, 5 foot, 5'2", is somewhere between a BMI of 20 and a BMI of 24. So find your height right here. Look at the weight. You can't pick any higher than a BMI of 24, and you can't pick any lower than a BMI of 20 unless you want to be with Ally McBeal. So write down your weight that you want to be. The first thing that every one of my patients does is they weigh themselves every week. Remember before surgery about the scale? Did anybody in here love the scale? This is actually a scale I like. It's made by a company called Tanita. You can't read it on there. The reason I like it is because it tells you your fat percentage. The other reason I like it is it goes up to about 999 pounds. Okay? You can get it online from tanita.com, but it tells T-A-N-I-T-A. There it is. That's how many calories you use every day. Okay?
Really?
Yeah.
That's how many calories you use if you do nothing.
If you do, funny you should mention that. We're going to get to, this is nothing. If you do nothing, this is how many calories you use. If you sleep, will you use more or less calories? You'll use more. Sleeping actually raises calorie usage. I tried the NAP program for weight loss. I just couldn't get enough sleep. How many of you got to be a patient because you gained about 10 pounds a year and over 10 years it became 100 pounds? How many of you? Yeah, most of you, right? Now you saw how many calories you use a day. Hopefully you wrote it down. Did you write out your BMR, everybody? All right. If you had 96 calories a day above and beyond that, just 96 calories, in 1 year, you would gain 10 pounds. You know what else this is? This is walking 1 mile at a leisurely pace. If you had in the last 10 years walked 1 mile every day at a pace like this, you would weigh 10 pounds less at the end of that year. We don't talk about, in my program, diets anymore. These aren't diets. These are choices. You have to make better choices. And when you think about that 96 calories, boy, that's a pretty easy thing to say no to, isn't it? Is there anybody in here that can't find 96 calories you can get rid of in a meal? No. This is 2 pounds of butter. This is 6 teaspoons of sugar. To lose a pound a week, you have to burn an extra 500 calories a day. In a year, that works out to 52 pounds. You want to lose more than that, you have to eat smarter, and you got to move a little more. So, just think of it. If you're now sitting a few years out and you're saying, I want to lose this, you could lose a pound a week, and in a year, it's 52 pounds. Now, did anybody in this room have the experience that if you thought that nobody watched you eat it, that it would count? Our successful patients plan their meals. Meals are not accidental. Anybody ever shop while you're hungry? If you plan your meals, you can plan your shopping trip. If you plan your shopping trip, you know what you're going to eat. If you know what you're going to eat, you know how many calories you're going to consume. If you know how many calories you're going to consume, you can tell exactly how much weight you're going to lose. Your pouch or stomach should feel full. If it doesn't feel full, with good solid food, it's not going to work. Okay? I have patients telling me after I do a lap band or a robot, well, you know, I say, how much steak can you eat? Well, if I eat steak, I pull forever. That's the idea. We want you to feel full. If you feel full, you're not going to. But if you're going to snack, and you know when you're going to snack, you plan it. When you're planning your meals, remember, your calories count. I don't care what the late Dr. Atkins says. Fish will work for you better than Kentucky Fried Chicken. We call them simple versus complex, or high glycemic index versus low glycemic index carbs. And here's how carbs work. Carbs are essentially complex molecules of sugar. Basically, table sugar is two simple glucose molecules strung together. The more complex they are, and they're complex with other things such as fiber, pectin, amylopectin, etc., the more complex they are, the slower those carbs burn. Let me give you an example. You eat a piece of bread like this, your blood sugar rises rapidly within the first hour and falls rapidly. What happens when your blood sugar falls? You're starved. And your body remembers the last thing you ate, so you eat it again. Okay? What happens when you eat something like a piece of fruit? Two things. Number one, it sticks in your pouch for a little while, or your stomach. Your blood sugar rises, but slower, and you're satisfied longer. Alcohol is what I call the forgotten calorie. Why do I call it the forgotten calorie? Because this is ultralight beer. Here's what it comes, 12 ounces, 99 calories, 4.6, and they say, well, we have low-carb beer. Vodka. Dr. Atkins would say, well, you know, there are no carbs, it's got to be good. Remember what I said about 96 calories a day? There it is. Your body doesn't care. Now, let me tell you a secret about your new anatomy. When you eat protein, you will probably not absorb all of the calories in the protein. When you drink alcohol, you will absorb every single calorie. Every one. Water is critically important. I think water is the best fluid you can get. I don't like pop. I don't like a lot of other crap. I like water. I happen to like lightly carbonated water, which gives some people fits, but I like water. But here's some things you don't know. Many patients call me up and they say, I have leg aches, do I have low potassium or calcium? And I say, no, you're low in water. How can I be low in water? I'm drinking a lot. How much are you drinking? Tons. Remember, you got to measure it. If you're not drinking 2 quarts or 2 liters a day, and that's at rest, that's changing the channel. You're not getting enough water. If you're constipated, you're not getting enough water. Guess what happens on a busy day when I am in surgery and seeing patients in clinic and running back and forth? How many steps am I taking?
No.
About 2,000. I have to walk every day to get my 10,000 steps in. If I walk every day to get my 10,000 steps in, I see the scale go down. If I don't walk every day and I'm weighing myself weekly, which I do, I see the scale going up. You have to measure everything. You have to measure your meals, what you're eating. You have to know your calories. You have to know the steps you're taking. You have to know how much water. You have to weigh yourself every week. If you get to where you're on a walking program and walking 2 to 3 miles a day, you know you're getting in your steps. If you've gotten to the point where you're taking in enough water and you're no longer constipated, you don't have the fatigue, you're not having any cramps, you're going to do it. And guess what? You're going to measure yourself to goal. That's what's going to happen.